Welcome back. Next up on Pain Diaries, we're going to answer all things about Reactivate, a neuromodulation device that's for restorative low back pain. First, let's play the video so we can refresh the knowledge for those of you that know about the device and also play it for those of you that are just learning about it.
Mainstay's Reactivate is an implantable device designed to electrically stimulate nerves to activate key stabilizing muscles of the lumbar spine. Chronic low back pain consists of an ongoing cycle of muscle weakening, pain, and activation suppression of the core spine muscles by the brain. Reactivate is designed to stimulate the nerves responsible for contracting the multifidus muscles. The brain senses the muscle contractions and in response can trigger restoration of muscle control. With the multifidus again providing joint stability, the continuing cycle is interrupted, facilitating a recovery from chronic low back pain.
So, let's talk about what the key differences are between Reactivate, which is a type of peripheral nerve stimulation, and spinal cord stimulation. So, Reactivate and spinal cord stimulation are different in almost every way. Most importantly, they each target a different chronic low back pain patient. So, with populations, Reactivate addresses the musculoskeletal, mechanical, axial, and predominantly nociceptive chronic low back pain. Just that deep ache that a lot of people have doing the regular activities. Whereas spinal cord stimulation addresses predominantly the neuropathic chronic low back pain and radiculopathy, meaning nerve pain, especially nerve pain from scar tissue and nerve pain that can go down the leg, which you might consider as sciatica. They also employ different mechanisms of action. Reactivate aims to restore those multifidus muscles, restoring multifidus muscle control and functional segment stability in the low back, whereas spinal cord stimulation aims to interfere with the perception of the pain with a palliative objective, so restorative versus palliative. They have a completely different delivery schedule as well. Reactivate delivers stimulation to cause repetitive multifidus contractions during 2 30-minute sessions daily. Spinal cord stimulation can deliver stimulation 24 hours a day, 7 days a week, based on the patient's ability to control the device, whether they want it on or off. Somebody else wrote in, can you explain palliative versus Reactivate restorative treatment options? Let's explore that. Palliative treatment options treat the symptoms and typically cover or mask pain signals to the brain so that the body doesn't feel the pain. They typically focus on helping manage the pain by scrambling the pain signals or burning or removing a nerve versus treating the underlying cause of the pain. Reactivate restorative neuromodulation and neurostimulation treats the cause of mechanical chronic lower back pain by stimulating the nerve to elicit a contraction of an involuntary muscle, the multifidus muscle, which is the largest stabilizing muscle of the back. This for 30 minutes a day to restore function and neural connection back to the muscle. Over time, the therapy is able to restore neuromuscular function, and the byproduct is reduction of pain as the body is restored to its natural state. So what sort of imaging can patients receive with a Reactivate system implanted? CAT scans, fluoroscopy, and x-rays are all compatible with the Reactivate device. Special considerations must be made for MRI scans. Patients should review the Reactivate manual for more detailed guidance regarding MRIs. Is the Reactivate system like a TENS unit, also known as a transcutaneous electrical nerve stimulation unit? No, not at all. Actually, the Reactivate system is specifically implanted to stimulate the nerves that control the muscles that stabilize the lumbar spine. This results in a comfortable therapy that cycles deep muscular contractions with the goal of restoring the neuromotor control of the lumbar spine, or the low back. In contrast, a TENS unit attempts to block painful signals by transmitting electrical signals through the skin. You put a sticky pad on your skin, attach it to the device, and it pushes the electrical signals through. This results in a completely different sensation and does not address the root cause of mechanical back pain. People also asked, how long does the Reactivate system last? The Reactivate system is tested to have enough battery life to last a minimum of 5 years with continuous use, 2 30-minute sessions per day. But in practice, Reactivate systems are actually in patients and they're lasting much longer. In the case of needing to replace the battery, a straightforward procedure to switch out the battery can be performed without having to replace the implanted leads. So where is this IPG, implantable pulse generator, or the battery, placed? So the IPG, which also contains the battery pack, is generally implanted in the upper part of the buttock, below the belt line and above the seat line, or in the flank between the hips and the ribs to make it as comfortable as possible. It's tailored to every individual patient. Another question, will the patient be able to see or feel their implant? Well, patients will typically be able to feel where the IPG or battery is located with their hands. After 60 to 90 days, the body will heal around this site to the point where it's less perceptible to the patient, and they may be able to see the location of the incision but won't actually be able to feel it. You might be able to outline it through their skin when standing naturally or under clothing. What do the therapy sessions actually feel like? Most patients say the sessions feel like a pleasant series of deep muscle contractions, like flexing a muscle in an arm or leg, but in the low back region. The system is programmed to be as comfortable as possible so that it's easy and even enjoyable to perform the daily therapy sessions. Another question somebody wrote in, when will I start feeling and seeing results with Reactivate? So it's a long-term solution. Most patients report benefit within 3 to 6 months, but some as early as 1 month, and others can take 9 to 12 months. This can be functional improvements such as sitting, standing, walking tolerance, sleep, and activities of daily living, showing improvements. People are also able to do more with pain. Pain improvements include typically following a similar path where pain is subjective with numerous influences. 2/3 remitters by 2 years. And another question, do I have it in me forever or can it be removed? The device can be removed. It's entirely a reversible procedure. A small percentage, 2.9 to be exact, have had it explanted due to resolution of their symptoms at 3 years. A cumulative benefit with continued use at 3 years has been observed as well. People also want to know, can you still get a massage, do physical therapy, have chiropractic sessions with the Reactivate device? Well, it's important to note that no deep tissue or manipulative treatments where the leads and the battery is placed is recommended. In consultation with your treating doctor and as clinically indicated with an exercise program is also very important. I also advise, do not attempt anything new or strenuous for the first 3 months as to not influence the outcomes from Reactivate. How long has this therapy been on the market? It's been researched since 2008, and clinical trial cases started as early as 2014 in Europe and commercial implants since 2020 in Australia and the United States. Long-term follow-up on patients is nearing now 9 years. So how many patients have it? Approximately 1,000 patients are implanted across Australia, the United States, the United Kingdom, and Germany, including clinical trials as well as commercially. If needed, can I have spine surgery at a later date? Spine surgery can happen at a later date if indicated, because the procedure is completely reversible. After implant, when can I resume normal activity, including exercise and physical therapy? It's recommended that limiting activities to low or moderate levels during the first few weeks after implant is followed. Do specialists recommend trying to get in shape first, or is this someone who ignored the pain so long, it's just too late with anything to do? Well, it's always recommended to optimize physical therapy and physical condition pre and post surgery, and this is true for any surgery you get. It's very important to optimize your health first. Reactivate works closely with physical therapists pre and post implant to optimize their recovery experience. Every patient's muscle function is unique, but most physicians agree as long as about 20% or more of the muscle is present, not atrophied, there may be an opportunity for the Reactivate to work. The key is to recognize this pathology early and intervene before it becomes beyond repair. So So what does the muscle stimulation of Reactivate therapy feel like? Most patients report Reactivate feels like a deep tissue massage or contraction workout type experience. How long can I feel relief from my pain? Every patient has a different return to function and pain relief experience. However, most patients report seeing functional improvements prior to pain reduction, with more and more pain reduction over time, typically after 6 to 9 months. There are many variables that contribute to this. Can I get Reactivate if I have had an ablation or radio frequency ablation for my low back pain? It's definitely recommended to wait a minimum of 3 to 6 months, allowing the ablated nerves to grow back before Reactivate, as Reactivate stimulates and uses this nerve to contract the multifidus muscle, the largest stabilizing muscle in your back. Another patient wrote in, have you seen improvement in the mental health of patients post-surgery? Patients have reported an increased quality of life after Reactivate as they have returned to function and reduced pain, which has positively affected their mental health. It's important to note, though, every patient experience is very different. So, you found all this fascinating. What is the process of becoming a candidate, and will your insurance cover the cost? Physicians will review your clinical history, functional clinical cues, physical assessment tests, as well as look at the MRI imaging of your multifidus muscle to look for atrophy. Once a diagnosis of multifidus dysfunction is recognized, you can be a candidate for Reactivate. Medicare currently covers Reactivate, as well as Blue Cross, Blue Shield of Alabama, but every commercial insurance provider's policies are a little different and need to be evaluated to see their policy coverage determinations. Mainstay Medical has a reimbursement support and verification program team that is dedicated and specializes in working with patients, their providers, and their insurance companies to advocate for coverage on medical necessity. Patients can work directly with their Reactivate therapy manager and RSVP teammate, as well as their HR manager, insurance provider representatives, state legislator, and other opportunities to advocate for Reactivate. Well, there you have it. Spinal cord stimulation versus peripheral nerve stimulation and our special guests. I would really like to take time right now to offer our special guests a great thank you for being here on Pain Diaries. What a great discussion on discussing all things with low back pain, physical therapy, Reactivate, chiropractic care, and frequently asked questions with regard to Reactivate. Again, I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine. I know this episode has discussed multiple treatments, all of which we utilize in our practice. Remember, you can find my partner, Dr. Matt Wiederholtz, and me at 4126 Southwest Freeway, Suite 1700 in the T-Mobile Tower on the feeder of Highway 59 in Houston, Texas, or on Main Street in League City, Texas. We're happy to discuss any of these treatments featured on this show, as we incorporate all of these based on a patient's need. Subscribe on YouTube to Pain Diaries Dr. Manzi to catch all my shorts and episodes, bringing you all things pain-related and educational. This information on the newest and best technologies out there are available to make your life better. Remember, this is Pain Diaries. Take care of you so you can take care of business.
This has been a Now Media Television feature presentation. All rights reserved.